Hello, my name is Jonathan Vita, and today I'll be presenting my evidence-based practice project proposal. The project is focused on improving wound care outcomes that through the use of structured protocols and advanced treatments like negative pressure wound therapy or NPWT. The proposal is based on a real and ongoing challenges nurses face, ensuring wound heals effectively while avoiding complications. Let's take a closer look at how these interventions can make a difference. So the introduction. So wound care is one of the most important responsibility nurses take on at the bedside. Poor wound care can delay healing, increase infection risk, prolong hospitalization, and even lead to life-threatening complications. Despite new research and advancements in treatment, many facilities still lack a consistent and effective approach to wound care. The project seeks to change that by introducing a standardized, evidence-based wound care protocol using negative pressure wound therapy to help patients heal faster and more safely. So the background and rationale. So wound healing involves four essential phases: hemostasis, inflammation, proliferation, and remodeling. If any of these stages are disrupted due to poor care, healing is delayed and complications become more likely. This is often the result of inconsistent wound assessment, improper dressing selection, or a lack of nurse training. Using a well-structured protocol that includes innovative wound therapies can help restore consistent and improve healing times. Standardizing how we assess, clean, and treat wounds can provide a major improvement in bedside care. So the project objectives. So there are four key objectives. First, to create and implement a standardized wound care protocol over the span of 6 weeks, incorporating and advanced interventions like NPWT. Second, to provide education and hands-on training to nurses and staff who are involved in bedside wound care. Third, to reduce the number of wound infections that develop in the hospital and to promote wound healing overall. And then the fourth, is to strengthen nurses' confidence and knowledge by offering up follow-up sessions, including post-conferences discussing wound cases that worsened or could have been managed differently. These objectives aim to improve both clinical outcomes and the daily practice of the nursing staff. So the study design. The project will use a non-randomized pre and post intervention design. This allows us to measure real changes in wound healing and nurse practice by comparing data before and after implementation of the protocol. It's a practical approach that can be done in real clinical settings without disrupting the patient care. So the practice change. The key change is the introduction of structured wound care protocol that includes instructions of staging, dressing, infection prevention, and the use of negative pressure wound therapy when appropriate. Nurses will learn how to properly clean wounds, apply the right dressing, and use MPWT devices to support healing. This change is designed to be sustainable, practical, and aligned with what we know works best in wound care. So the implementation plan. The implementation takes place over four main phases. Week 1 and 2 will focus on creating and finalizing the protocol and preparing educational materials. Week 3 and 4 will focus on educating the staff with in-person, online, and hands-on training. Weeks 5 and 6 will see full rollout of the new protocol across all the units. After that, we'll conduct performance reviews, gather staff feedback, and bring in wound care mentors to help support the transition. So barriers and solutions. Some expected challenges includes the cost of new negative pressure wound treatment equipment and possible staff hesitation towards changing routines. To address this, we could start with high-risk patients first and slowly expand. Training incentives and mentorship programs can also help staff feel more comfortable. Funding can come from hospital grants or even fundraising campaigns. The key is to stay flexible and focus on showing how the changes can improve wound care. Next is the evaluation methods. So we'll evaluate the product by tracking wound healing progress, so size reduction and infection rates through chart audits and wound logs. Nurse knowledge and confidence will be measured through surveys before and after training. Most importantly, we'll ensure patient privacy and obtain proper consent so the project follows all ethical standards. Expected outcomes. The expected results are straightforward. Wounds will heal faster and infections will decrease, while nurses will feel more confident and consistent in wound care practices. Over time, the consistency can lead to better outcomes for patients, reduce hospital costs, and a stronger culture of evidence-based care within the units. The conclusion. So, wound care is a fundamental part of nursing, and when done well, it leads to better healing, better patient experiences, and better outcomes. This project offers a clear, achievable way to improve wound care through training, structure, and evidence-based innovation. By focusing on both the nurse and the patient, we can create a safer, more effective clinical environment for everyone. And then here's my references. Thank you guys so much.